Dr. Rick Finch here from Vet Triage. We're going through this issue of JAVMA from February 15, 2015. We're going to review this Pathology in Practice. This is a horse kidney. In case you've never seen one before, it's a cut surface. The drawings down below this is called a horse. And here are the kidneys on the outside. It's got this triangular shape to them. When you cut the kidney in half vertically, then you have the insides of it, which look like this. And then you can see here the cow with its kidney has kind of like a corn, corn kernel appearance to it. And when you cut it, it looks like that. And then a doggy, and then more of a kidney shape that we're used to seeing. And then here's the insides of it. So this is a 24-hour filly, 24-hour, not month, not year, 24-hour, evaluated in Kansas State University for diarrhea, inability to stand, lasted about 6 hours. It had complete failure of passive transfer. What that means is the colostrum that the foals ingest from the mare is crucial to their survival in the first few hours of birth. And so complete failure of passive transfer implies that the horse was so sick in this case that it didn't suckle, didn't get any of the colostrum, and so it was not bestowed upon it the protective antibodies from the mother. So because it couldn't stand, and if you can't stand, you can't reach the mom's mammary glands, and you can't ingest the colostrum. So they treated the filly, with plasma transfusion 12 hours prior to evaluation. Physical exam found fever, fast heart rate, prolonged capillary refill time, hyperemic mucous membranes, diarrhea. Blood work had panleukopenia, so that means that all the white blood cell lineages were low. Hypoglycemia, probably because of sepsis or malnutrition. High serum creatinine, which could be pre-renal, renal, or post-renal causes. Also could be from muscle breakdown as well. Hypoproteinemia, so protein loss, probably through the kidneys based on what we're seeing here so far. Hypoalbuminemia, which makes sense through kidney loss. High serum sorbitol dehydrogenase activity. Metabolic acidosis was detected on venous blood gas analysis, and the horse was euthanized. They found yellow gelatinous and edematous capsules of both kidneys, looking like microabscesses. The small intestine, large intestine was mildly anemic. Edematous, rather. The small colon revealed yellow liquid feces. So they did a necropsy. Multiple embolic, multifocal to coalescing abscesses found on the glomeruli of the kidneys and the adjacent interstitium and tubules. They had neutrophils in the samples as well as gram-negative bacterial rods. They diagnosed, based on culture, they diagnosed Actinobacillus equuli that affected this horse. They also did find equuli, hemolytic variant, and anaerobic culture found Clostridium perfringens, which was a type A. So the morphologic diagnosis was severe acute embolic suppurative nephritis with numerous colonies of gram-negative bacterial rods. And then the case summary was Actinobacillus equuli, embolic nephritis in a neonatal filly. In the top picture here, that's the kidney, and the arrow is pointing to the glomerulus. The asterisk on the top corner is showing that same glomerulus that was surrounded by a bunch of neutrophils, and there's bacteria in there as well. Renal cortex on the right kidney, colonies of bacteria that often involve glomeruli, and it's filled with bacteria and surrounded by sheets of neutrophils. Then on the bottom here, they show with special staining that the arrow there is showing bacteria that are infiltrating the interstitium. Comments. Neonatal bacteremia caused by Actinobacillus equuli is known as sleepy foal's disease. This bacteria is a natural commensal bacteria on mucous membranes of adult horses. Therefore, it is thought that foals are directly infected by their dams through the oral cavity, respiratory tract, or umbilicus through parturition shortly after birth or after several days of age. Failure of passive transfer, dam malnutrition, environmental factors are all known predisposing factors. Infection with this bacteria among foals is considered sporadic. There has been outbreaks reported in one horse premises in Great Britain. 4 neonatal foals were found dead, of which 2 were submitted for post-mortem examination and found to be positive. Metabolic acidosis, fibrinogenemia, leukopenia, hypocalcemia, and hypoglycemia can be found. Survivability is about 50%, 54%, and that's pretty typical of any kind of septic process, pretty much like regardless of species. It's 50-50 shot of survival. It could be associated with septicemia, abscesses, arthritis, or pneumonia. There is a Actinobacillus bovis, which causes wooden tongue disease in cattle. Rarely, this Actinobacillus equuli can cause abortion, septicemia, and polyarthritis in swine. There are 2 subtypes of this bacteria, Actinobacillus equuli subspecies hemolyticus and Actinobacillus equuli subspecies equuli. The latter variant is associated with foal and piglet septicemia. These, as well as additional species and subspecies of Actinobacillus, have been implicated in mare reproductive loss syndrome. Fibrinosuppurative polyarthritis, polysynovitis, and abscesses and other viscera can also be found. Other bacteria that are a common cause of embolic nephritis include Erysipelothryx ruseopathele, which is in pigs, Truperilla pyogenes, also called Arcanobacterium pyogenes in cattle, and finally Corynebacterium pseudotuberculosis in goats. So another interesting case, just a single case report for those who are interested in horses, and there you go. We'll see you in the next one. Thanks.